So tell us, what are some of the uses of AI you've seen already implemented in healthcare?
Sure. Well, Health Catalyst, being a data and analytics platform, has used AI in a number of different predictive risk score assets that we deploy within healthcare. But I think more modern use of AI includes two main things that I think we're focused on. One is personalization. So we do patient engagement, consumer engagement, and we're deploying AI models to understand the best way to engage people, and that means choosing the right content, choosing the right time of day to send a message, choosing the right follow-up material to send, and the modality to send it in, and we're building models that determine the right thing to say based on who they are and what they're most likely to engage with. Additionally, AI is working for us in our tech-enabled managed services business, where we're able to take resources from our healthcare provider customers and supercharge them with generative AI to perform common workflow, administrative tasks that otherwise would be very difficult and time consuming. So generative AI is really changing the game from a workflow efficiency perspective, and I'm definitely seeing that used a lot within healthcare.
So I've seen rows and rows and rows of AI implementations. Some of them are, okay, really? Do you do that? But the ones I've seen that are really good are very much focused on efficiency, back office, workflow. A really good one I saw yesterday was how the AI could basically look at the entire chart of a patient and then give a summary to the doctor. So the doctor doesn't have to go back and forth, particularly if it's a long one. I've seen workflow management, getting nurses to be in the right place at the right time as well as be everywhere. So that helps with the burnout and the scheduling and that sort of thing. So those use cases I think are really, really good and are being implemented straight away because it helps people at the health system level become more efficient or manage their resources better. Where I've seen the crazy ones, it's like, oh, well, we're going to change the way we deliver care remotely using a bot. And I'm like, okay, that may work for a chronic or a normal patient, but how are you going to say talk to somebody who's just been left the hospital because they've been in a surgery? I'm not sure a bot can help there. I think you need humans for that. So I think AI for the basic workflow, making things efficient, making me more useful, wonderful. Some of the bigger vision use cases, I think, have a bit to go.
Yeah, I think one of the things as we are expanding nationally, are trying to address is there is a ton of relevant models that have been really localized for so many years. So the leading academic medical centers in the country have these multidisciplinary GI models that use behavioral health, they use dietitians, but a lot of that hasn't been traditionally reimbursed. And just across the country as we scale, cross-licensure is really, really hard. And that's something that we're trying to, get cross-licensed so we can serve the entire country with our multidisciplinary model, which is getting credentialing for our GI provider, our behavioral health physicians, as well as our dietitians and our entire system of care. But doing that, one of the things that is holding us back, candidly, is there can be so much that we can do as a country and at the national level to make that cross-licensure a lot easier so that these virtual models that we are trying to expand and scale access to in an affordable way can really reach the people that need it.
Awesome. Thanks, Isabel.
Yeah.